Some of the challenges that are facing local government clients at the moment is the continual challenge that austerity is bringing to their organisations. A lot of those organisations have already driven a lot of transformational change in their organisation in the back office, but they're starting to look at newer and more innovative ways of releasing more efficiencies. Ultimately, there are areas in local government service delivery which have traditionally been considered to be off limits. Those areas being adult social care, children's services. There is great potential in these services to ultimately transform the experience of customers, but also providing significant operational and process efficiencies to those local government organisations. Demographic changes are hugely impacting the market, as the forecasts are all showing that over the next 10 to 15 years, the ageing population of 65 and above will grow exponentially. As local authorities carry around about 40% of their budget being attributed to the delivery of adult social care, it's a huge concern for local authorities that they're going to be able to continue to deliver the level of services that they already are. So they're really looking at the opportunity to transform their operations further and ultimately delivering better experiences to customers. Legislative changes on the horizon. We have a seismic shift in the way that adult social care services are being delivered in the form of the government's Care Bill agenda. Coming in 2016, it will see a significant raft of changes in the way that the qualification for care, the valuation of the care budgets, the personal care budgets that individuals will have, and also the way that they can self-administer those budgets is changing dramatically. At the moment, there is no full legislative and governance framework in place. Also, people are waiting for the publishing of the National Assessment Framework, which will govern the whole process. But what we're saying to our customers is don't wait for those legislative changes to come into play. You need to start thinking about what's on the horizon now. And ultimately, we know that the way that they need to look at their service delivery options moving forward is to really transform their relationship and realise that there are practical improvements that they can make in their day-to-day working to make sure that they are providing the access to services that their customers demand. The services that we're really talking about here and what these are actually applicable to are those that actually sit behind the front line. So the service delivery at the front line is really being supported in the back office. So Capita's local government services business has a fantastic track record in delivering office and business services, the services that actually form the administrative function that support those frontline service delivery challenges. So from the perspective of the incoming impact, what we want to do is to help social workers to be able to do more social work, so to remove the administrative burden. In addition, we're providing services in areas such as the welfare benefits assessment regime, and realising that the incoming Care Bill impact inevitably is going to lead to an increase in the amount of assessments that are going to be taking place. And as a result, we're expecting to provide significant support to our local government customers to make sure that the actual process of the assessment, from when they're assessed that they need care as to when they then start paying for that care or receive support for that care, is as short as possible to minimise the risk and exposure both to the customer but also to the council as well. In addition, roles in financial adult safeguarding, so making sure that we're the sticking glue between the customer and the appointeeship and the deputyship, and managing that process to help realise and make sure that that role is being supported as coherently as possible. Capita really sees that technology will play a significant role in the future in terms of making people realise that the way that the modern community wants to communicate with the local government organisation has changed dramatically. So we're seeing technology as being a huge enabler in the future, both in terms of making sure that customers have round-the-clock access, but it also has a role in making sure that the relationship between the local authority, the customer, the organisation that's providing the care is as seamless as possible, because ultimately these individuals will have their personal care budgets and they will be responsible for choosing how they pay their care budget to the provider. So that needs to be a seamless environment, and the perfect way to do that is by providing on-demand access. So we see technology playing a huge role. We also see technology playing a huge role in supporting the role of the social worker. They are spending a huge amount of time in both resource planning and also preparatory work for their day-to-day. And by that what I mean is having to travel into the office, print off sometimes huge reams of case files, and ultimately this means that the social worker is being put under a huge amount of administrative burden. So if we can provide them with tools that allow them to remotely access their solutions, to allow them to download case files to take into their meetings, and then introducing a better resource management facility, means that social workers will be able to do more social work at the front line, which can only lead to positive outcomes for the communities to which they serve. Capita's local government services business has a fantastic reputation of contact management and enhancing now options in our contact centres to help to do more at the front line in terms of first point of contact. So rather than putting again an administrative burden into the back office, we're enhancing our contact centre operations to be able to resolve some of these challenges at first point of entry. There is a focus for local authority customers now to become more commissioning based, to make sure that they can really look at a wider spectrum of service delivery options and ultimately further deepening the ties with communities for those that are in the best place at the front line to deliver those services, in some case at a very local level. My personal view around what the delivery of social care will be like in the future is that we'll see obviously technology playing a more prominent role in making sure that those that are actually receiving care have the tools necessary to feel confident that they are in control of their services that they're receiving. But I also see that local authorities will see a different way of working in terms of the social care sphere as well. So really where I see this is that social workers will be able to do what they've always been able to do, which is to do more social work at the sharp end and less worry about the administrative burden, because we'll alleviate that headache for them.